Good afternoon, everybody. Good afternoon, Virginia. This is that time we come together, and the last time we'll come together this week to remember that we will get through this, and we will get through this together. There is a big, bright light that will be the end of this pandemic. We got to be careful, protect one another as we move towards it. But today you're going to hear a lot more about our plan to make sure that we answer that critical anxiety of individuals of when it's my time, where do I go to get my vaccine? And that we are also putting the infrastructure in place to where when we have, and we pray for this, significantly more vaccine supply that comes, that we can get it out pretty quickly. Let's start with some good news. Today, I'm happy to announce a new project from a homegrown Kentucky company that's creating 200 new jobs in the Bowling Green area and helping to create a better Kentucky for our residents. Material Handling Systems got its start right here in the Commonwealth more than 20 years ago. Since its founding in 1999, the Mount Washington-based business has grown from a small, one-room operation to a global company that employs more than 2,000 people, including more than 500 Kentuckians, and it helps distribute products all over the world. The $7.6 million investment to locate in a 181,000 square foot facility in Warren County's Kentucky Trans Park will support the global headquarters in Mount Washington with steel structures for conveyor and sortation systems. This project is just the latest reminder that Kentucky is home to successful businesses that got their start right here in the Commonwealth. We talk a lot about businesses that we attract to Kentucky, but most of our jobs are created by Kentucky businesses that grow and that thrive. MHS is among the nearly 60 material handling equipment manufacturers located in Kentucky that employ over 3,200 of our Kentucky families. A key part of this project is MHS is important to our distribution and logistics industry, which consists of more than 580 facilities and nearly 78,000 employees. MHS supports major logistics companies in our state like UPS and FedEx Ground. That's just another reason this is a great project for Kentucky as we continue to build ourselves into the logistics capital, certainly, of this country. Thank you to the leadership at Material Handling Systems for selecting Kentucky for this next great expansion. And to everyone at the state and local level that helped make it happen, thank you. Our Kentucky families, thank you. This new MHS location is a great addition to the Bowling Green business community and to Kentucky, and I look forward to helping you make that next great expansion. With every one of our great Kentucky companies that adds jobs and expands, first thing we tell them is feel free to do more, and that's what we'll try to continue to foster. Second, today I signed a proclamation declaring January 28th, 2021 as Hunger-Free Day in Kentucky. Hunger is something that has been around for far, far too long, but in a modern world and in a state where we grow so much food, it's something that we ought to be able to finally solve. Too many of our Kentucky kids and Kentucky families don't know where their next meal is coming from. I hope as we come out of COVID, where we have taken care of each other in ways that we've never seen in our lifetimes, that this can be one of those other crises that has been around that we can truly start to address. I was also excited to announce a donation from the Beshear Coleman Inaugural Fund of about $16,000 to Feeding Kentucky. I couldn't think of a better use of dollars from that time of celebration to help people through this time of need. The work of those in Feeding Kentucky has been nothing short of heroic during COVID, and we have been honored to have our National Guards men and women working in their facilities to ensure they have the necessary personnel to get food to those that are in need. Their efforts deserve our full support. Thank you to Feeding Kentucky, to all of our food pantries, to everybody out there who helps someone find that next meal. All right, today's COVID report. Good news and tough news, and it seems like it's the trend we're seeing every day. Let's start with the good news. Today we're reporting 2,947 new cases of COVID-19. Doesn't sound like good news, and it's far too high. But this is the lowest Thursday we've had in 4 weeks. Our numbers of Kentuckians hospitalized, currently in the ICU, and currently on a ventilator, all down compared to yesterday. Our current positivity rate is 9.04%, the fourth straight day under 10. And I believe we've had almost a week, if not more, of that number going down and down and down. Folks, our trends are going in the right way, and that's a good thing. And it's because of your work, wearing a mask, social distancing, cutting down on your contacts. Thank you for that. But the result of so many cases and of our exponential growth and times when we were having 5,000 cases in a day is we are seeing the significant loss that creates. Today is our highest day of announced deaths, with 69 new deaths we're announcing in Kentucky to bring our total loss to 3,611. When we look at where those are, it's a 93-year-old woman in Anderson County, a 90-year-old woman and a 92-year-old man in Bath County, 4 individuals in Boyd County, 3 women ages 91, 76, and 77, and a 79-year-old man, a 90-year-old woman from Casey County, 4 individuals from Davis, all men ages 72, 80, 87, and 91, 91-year-old man in Edmondson, 2 individuals, both men from Fayette County, ages 57 and 80. 2 individuals in Fleming County, a woman 101 years old and a male 73. 79-year-old man in Graves County. 7 individuals from Hardin County, 3 women ages 81, 83, and 83, and men ages 53, 69, 73, and 89. 61-year-old woman and a 77-year-old woman from Harlan County, 77-year-old man from Hart County, 83-year-old woman from Henderson, 88-year-old man from Henry, 83-year-old man from Jackson, 10 individuals from Jefferson County, 3 women ages 75, 81, and 85, and then men ages 62, 74, 77, 86, 88, 90, and 94. 83-year-old woman from Knox County, 92-year-old woman from Lincoln County, 3 McCracken County residents, 2 women ages 77 and 80, and a man age 67. 80-year-old woman in Madison, 72-year-old man in Marshall, 80-year-old woman in Mercer, 95-year-old woman in Mercer, 3 individuals from Oldham County, an 83-year-old woman and a 71 and 87-year-old man, 71-year-old woman in Perry, 59-year-old man in Pike, 64-year-old man in Pulaski, 80-year-old woman in Rowan, 84-year-old woman in Shelby, and a 74-year-old man in Shelby, 77-year-old man in Taylor, 72-year-old woman in Todd, 74-year-old woman in Warren, 4 Washington County residents, 3 women ages 69, 83, and 94, and a 41-year-old man. 63-year-old man in Wayne County, 89-year-old woman in Webster, and a 71-year-old man from Webster. Now, not all of these deaths are from the last couple weeks. We have the committee that meets to ensure that each individual that we list as a loss, that COVID was a real contributing factor, and some of that made that list larger, but these are all people we've lost, at least in part because of COVID. So let's remember how dangerous it is, even if our cases are headed, our trends are headed in the right direction. Today we have 5 counties with over 100 cases, new cases: Jefferson 433, Fayette 218, Kenton 138, Davis 104, and Greenup 104. Now, today's memorial is a man we lost, again, a state employee, who's my age. Today, we honor another one of our own on Team Kentucky as we share the story of Jonathan Alexander, a team member at the Kentucky Transportation Cabinet's Office of Information Technology. He was 43, far too young to be taken from us. He passed away on January 23rd at the University of Kentucky Hospital after complications from surgery and COVID-19. Jonathan was known by all for his kindness. He always went out of the way to help those in need, not only in his personal life, but through his work. An example of this was through organizing the Big Tip Challenge, a fundraiser for restaurant workers whose jobs had been impacted by the COVID pandemic. He also organized the annual Salvation Army's Angel Tree Drive for OIT, making sure every Kentucky family had something under the tree at Christmas. Jonathan always said, if you're fortunate enough to be able to help somebody, do it. It's an amazing experience. Jonathan's passing is such a loss for Kentucky. I hope we can learn from his words and do right by our people. Our prayers are with Jonathan's mother, Brenda Whitaker, his brother Jason, and his many great friends and co-workers. We're also thinking of his beloved dogs who are family to him. That's Reese, Roxy, Riley, Rosie, and Rowdy. This is one of ours. It works with us here in state government. We mourn his passing. We think about and pray for his family, which I know is grieving. We think about his work family around him that feels this loss. And we know that we've got to continue to mask up, to protect one another, to make sure other families don't have to feel this loss and go through what Jason's family has gone through. So let's mask up in honor of him. Let's light our homes up green so his family and friends know they're not alone and we're holding them close in prayer. 43. To think we have, through the course of this, had at different times people try to argue that this only impacts our seniors. 43. Our long-term care facility numbers better than they've been in a while. 26 new positive cases, 34 new positive staff. Now that's a bigger number than both. We want to see those at 0. 6 new deaths attributable to long-term care. All right. Let's move to the exciting news. So today, we have some very exciting news about how we're building out the infrastructure here in Kentucky to efficiently vaccinate our people so that everybody knows where the place, when it's their turn, that they should go to get vaccinated is. Today, we'll be announcing some new regional facilities. Next Thursday, we'll be announcing more. And the Thursday after that, we will have some additional. So we will have announcements today and each Thursday of the next 2 weeks as we build out this infrastructure so that everybody has a high-speed throughput vaccination operation in their region, and they know exactly when it's their time where they can go. So today, we're announcing 4 new regional vaccination sites, and the first site as one of these 4 operated by Kroger. The 3 sites that you will see in just a little bit when we unveil our vaccine.ky.gov website are 2 in Western Kentucky. We'll show you those in a minute, Lourdes and Baptist in Paducah, as well as Ephraim McDowell. But our first Kroger site will be operated at the Kentucky Horse Park, and it's going to begin February 2nd at 10 a.m. It's going to be done in the Alltech Arena site, which is in-person indoors, but we're going to look at expanding to drive-through as the weather warms and supply increases. Sign-ups for this site begin at 5 p.m. today. You can see Kroger.com/COVID vaccine. is the website to go to. It's going to schedule out for the next 3 weeks, 1 week at a time. There are going to be 3,000 appointments in week 1. Each day it's going to open for, after today, for that one next day a week ahead of time. Now, this is important. These appointments, which are currently limited due to supplies, are for Kentuckians in Phase 1B, particularly those 70 and older. These should be 3,000 appointments at the horse park and others across the state aimed at getting our seniors 70 and up vaccinated. So today at 5 o'clock, please know 70 and up, you ought to be getting on this. If you don't fall into that category or 1A, we need you to wait. We'll be able to expand soon. And we've already told all of our regional providers that if they have extra doses, they can and should reach into 1C to make sure absolutely nothing goes to waste. As of today, all vaccination sites are asked to prioritize the 70 and older population until further notice. Other persons from Phase 1A and 1B remain eligible for vaccination. As vaccine quantities and available appointment times allow, persons in 1C may also be scheduled to ensure each site administers 90% or more of all their vaccine doses received in 7 days. So, we're pretty excited. Next week, we got 4 new regional vaccination sites coming online and our first Kroger site. Again, these are for 70 and up, at least for the next several weeks. But here's the other exciting part. Today, we're also unveiling a new state website, vaccine.ky.gov, and a hotline, 855-598-2246, 855, also 326-4654, that helps Kentuckians determine if they are eligible to receive a vaccine, and then it helps them find the vaccine in their region. The Find a Vaccine website and hotline will both be live after this news conference. Dr. Stack and Secretary Gray will offer more details in a minute, but I want to first share a video that walks through what Kentuckians can expect when they get on this website, how it's going to show them when they're eligible and where they should sign up to get their vaccine. Let's show the video.
You've probably heard a lot about the new COVID-19 vaccine in Kentucky. If you think you're currently eligible for the vaccine, you can use Kentucky's online screening tool to check your status and find vaccination sites near you. As vaccine supply is limited, Kentucky is following a phased distribution system of eligible groups. The Commonwealth is committed to making the vaccine available to all willing Kentuckians as quickly and as efficiently as vaccine supply allows. Meet John. John is 72 years old and believes he is eligible for the vaccine. John heads to the Find a Vaccine website to begin the quick and simple screening survey. The Find a Vaccine website is powered by Google Translate, and the website is available for translation. This will take just a few minutes. John clicks Get Started to begin. After answering a few quick questions, John sees he is eligible for the vaccine. By entering basic information, John can select a location on the map to see different locations in his community where he can schedule a COVID-19 vaccine appointment and get his shot of hope. Now John wants to see if his granddaughter Sarah, a college student, is also eligible. John clicks Start Over to start the survey again. The screening survey asks some quick demographic questions to determine Sarah's eligibility status, such as age, occupation, and whether she has certain health issues that put her at high risk if she gets COVID-19. Any basic information entered in the Find a Vaccine website is secure. Once John answers all of the questions, John learns that Sarah is included in Phase 3 of Kentucky's vaccine distribution plan and is not currently eligible for the vaccine. In the meantime, John can sign Sarah up to receive an automatic email or text message notification when her eligibility status changes. Signing up for notifications is fast, secure, and only requires your name, county of residence, and email address or mobile phone number. And just like that, John has taken a major step towards protecting himself, his family, and his fellow Kentuckians to stop the spread of COVID-19. If you need assistance using the Find a Vaccine website, contact 855-598-2246 for guidance and instructions on completing the screening survey.
All right. Today, I'm excited to have with us Pelly Roberts, the health leader for Kroger's Louisville division. I can't thank Kroger enough first for being the partner that transformed our COVID testing from not being able to help enough people to now being the national model. And I know with them, with our hospitals, with our local health departments, with our pharmacies, and so many others, we're going to do the exact same thing with vaccinations. Pelly?
Thank you. Thank you, Governor. Thank you, Dr. Stack, and the entire team. Kroger, we're so proud to partner with the state of Kentucky yet again, this time on efforts to make sure that all Kentuckians are able to access the COVID-19 vaccine as quickly as possible. Kroger Health, our vision is to help people live healthier lives, and it's never been more important than today for us to continue to expand the access to vaccinations across the Commonwealth. This work, like all the work we do, is guided by our values and our promise to feed the human spirit. So I am excited, as you are, to announce our first mass clinic that will begin this coming Tuesday, February 2nd, and will take place at the Kentucky Horse Park inside the Alltech Arena, as you stated. And the vaccines will be administered by appointment only. And again, we'll begin that Tuesday and run through Saturday, 10 a.m. to 4 p.m. So we will be supporting the Kentucky phased approach, which, as you stated, is currently in phase 1B, and prioritizing those patients that are 70 years of age and older. I do want to let everybody know that we will be taking the necessary precautions, ensuring that we have safety in place. So for both our customers that are coming through, as well as our associates that are administering the vaccinations, this will be security teams, social distancing, and of course, wearing our masks to keep everybody protected. Our goal really is just to have Kentuckians get vaccinated safely and efficiently by our qualified Kroger healthcare team. And that team will consist of both pharmacists and TLC nurses. So super excited about what we're able to offer, and just want to remind and engage all of our eligible phase 1A and 1B Kentuckians to visit our Kroger.com/COVID vaccine website to schedule, or call 1-866-211-5320. And once we have more vaccines available, as you said, we look forward to extending that partnership, not only in mass clinic events, but also in our little clinics and our pharmacies within the Kroger stores. So just super excited, and again, so proud of the work that our teams are doing. And we know Kroger and the governor's team, we truly make an impactful team in this fight against COVID, and just excited to continue that.
We can't thank Kroger and our other partners enough. This is a full team effort. And remember, the team is bigger than just those vaccinating. It's still those testing, those contact tracing, those enforcing the rules and the regulations that we need. Everybody's playing a part to help us get through this. So the 4 new sites that we added today are not the only ones. I want to show a map of where we are right now on sites that are vaccinating the public, and that you can be directed to through our new website on Find the Vaccine. In the next 2 weeks, successive Thursdays, we are going to announce additional openings that are going to help to fill in the spots on this map that do not have a center that we believe is close enough. We are committed to ensuring that everybody is close to a facility where they can efficiently get an appointment when it's their time, when supply allows, and to get vaccinated. We're really excited about this. Remember, testing didn't happen overnight. We are already providing more vaccines than we have supply, but a lot of this is the building and the planning for what we hope will be a larger amount at the end of this first quarter, which has been rumored, and certainly what we're being told will be a large amount in the summer based on new purchases. So with that, I will turn it over to, are we going Secretary Gray or Dr. Stack next? We'll go next to Dr. Stack.
Thank you very much, Governor, and good afternoon, everyone. If you could put up the map then again for me, James, please, that the Governor just showed. So the Find a Vaccine website and call center will go live tonight at 5 o'clock. And the Kroger Horse Park scheduling site will also go live today at 5 o'clock. And you'll be able to access the Kroger site or find it through the Team Kentucky website at kycovid19.ky.gov. or via vaccine.ky.gov, which is the new website that's set up specifically for this purpose. And again, that phone number that the Governor gave is 855-598-2246. On this slide, and there's the numbers there for you and the website again. On this slide, and as the video showed, the website and hotline will determine if you're eligible for a vaccine. And if you are, it'll take you to that map that is being projected right now and show the locations that are currently vaccinating. This builds on what we started to try to help healthcare providers, and we'll expand on this going forward, as the Governor said. And we look forward in the weeks ahead to announcing additional sites. Please remember, we've had a big focus on getting K through 12 school personnel vaccinated. Next week is the third and final week of that program. And so when that program concludes, we're able to swing even more robustly into expanding this network and increasing opportunities for those who are 70 and older in phase 1B, and then eventually to the larger population. When you click on the website on one of these locations, you'll get a drop-down information, a website link, and a phone number that you can contact for how you can schedule an appointment. We're all going to caution you. You've heard the Governor, you'll hear me, and you'll hear Secretary Gray. Quantity is limited right now, and that's the unfortunate constraint. This system is the first step to having a foundation upon which we'll grow and build a bigger network. When you go to schedule, please know not all of you will be able to schedule at the same time, and not everybody is clearly going to get in at the very start. This will get better with time, though. For those callers who are vaccine eligible, but who need assistance with technology or just are unable or prefer not to use the website, we'll have hotline operators at that phone number who are prepared to walk you through the website verbally by phone, and even perhaps help you to locate a site that may be able to help you schedule an appointment. For those who are not currently eligible, the operator can help you sign up for notifications about when you may be eligible or other updates. The vaccine website and hotline are eligibility screening tools and information tools. Please know the screening website is not the scheduling website itself. It'll help you find out which phase you are in. They are not wait lists either. So when you go there, it is to inform you and help you understand what phase you are in, and then put you in contact with vaccine sites closer to you where you can schedule directly. We do need your patience, as I've said. As we ramp up the vaccine sites, that map will have more dots as we go forward and more appointments. As the Governor mentioned, starting February 1st, the COVID-19 vaccination priority will be for phase 1B persons 70 and over. Let me just give you a positive note. As of today, I'm confident we have exceeded more than 100,000 persons in Kentucky 70 and older who have been vaccinated. We still have a little under 400,000 persons, we believe, in that age category to vaccinate, and that will be the solid focus February 1st and going forward. Other persons from phases 1A and 1B will still remain eligible for vaccination, and as vaccine quantities and available appointments permit, persons in phase 1C may also be scheduled to ensure that each vaccination site meets its 90% or more of all vaccines received that week being administered to interested persons. And then please remember, even when we are vaccinated, the vaccine protects people very, very well against severe COVID disease, but it does not ensure you won't get infected. You could still get infected and have little to no symptoms and spread the infection unknowingly to other people who have not yet had the opportunity to be vaccinated and are therefore still at elevated risk for bad outcomes. So please, even if you get vaccinated, it is still essential that we wear these masks, that we socially distance more than 6 feet, that we wash our hands, we stay home if we are sick, and we get tested if we think we've been exposed to or have the signs or symptoms of COVID-19. Folks, this is a good day, even though we face challenges getting this out as fast as we want because of insufficient quantities. It's a good day. We're going to be hopefully heading on a better path. If we can all just buckle down and follow the public health measures we've been urging for the last 11 months while we get everyone vaccinated, we can hopefully get to a better place. So thank you very much. And it's now my pleasure to invite Secretary Gray up here to give you some additional information. Thank you.
Well, thanks, Dr. Stack, and thanks, Governor. And first things first, I want to say that I don't know if the right word is privilege or not to have this opportunity or this role, but I know that so many of our citizens get to see this every day, and the governor every day, and Dr. Stack every day, and I've been able to do that as well. But in the last 2 weeks, I feel like I've been able to really get behind the curtain and see what's really been going on. And I can say without any equivocation, from the head and the heart, that the governor, Dr. Stack, and their teams have been nothing but remarkable. And it's high performance at every level. The governor says this often, that there's no I in teamwork. And I think that's exactly what's been exhibited so far in the pandemic and our response to it. But today, in our response and our action as it relates to the vaccine. And Governor, I want to thank you too for mentioning Jonathan Alexander. I got to know Jonathan in the transportation cabinet, and his death was a blow to everyone that knew him. This was a guy who had a smile on his face, he worked in our IT department. And whatever you asked him to do, he was there to do it. And I think his death illustrates the challenge that so many families have had and so many friends have had. And I think, Governor, you're being able to go through that every day reminds us of just how important this vaccine is today. And what I'm going to talk about, I appreciate you giving me the chance to provide a little context, but what I'm going to talk about is very specific today as it relates to the horse park, Kroger's first site, the first high performance, the first high performance vaccination site that we are standing up. Just a few quick details so everyone knows what to expect. First of all, everyone will need an appointment before going to the horse park. This is not a drop-in site. Now, Governor Beshear and Dr. Stack have talked a lot about the limited vaccine supply. We understand that if we're going to start opening regional sites, we have to supply them with enough vaccine to plan for staffing. That means they'll be getting a steady supply. Now, it's important to stop here and say this. The Kentucky Department for Public Health is continuing to work with all local health departments to receive vaccine to support their public health efforts in every county. But that doesn't mean that we can achieve everything for everybody overnight. As the governor said, it's all about supply, supply, supply. That's a constraint that we have today. But back to the regional site that will open Tuesday at the horse park. During the first week, Kroger will be administering up to 3,000 doses at the horse park. Okay, so once you have an appointment at the horse park, you will then, on the day of your appointment, you'll be heading to the horse park. And I want to take you through that. I'm going to ask for an external map of the horse park. We will have very clear signage on Ironworks Pike directing drivers into the park. Once you enter the park, and it's shown here, once you enter the park off of Ironworks, follow the signage to the All-Tech Arena parking lot. Parking, of course, will be free at the park. The actual vaccinations will be administered in the Alltech Arena building on the main pedestrian level, which is to the west. As you enter at the Alltech parking lot, you'll go, or to the Alltech Arena, you'll actually go to the left, to the west, where the arena entrance is located. Now, this is really important. Please wait in your vehicle, in your car, until 5 minutes before your scheduled vaccination appointment. And of course, then remember to wear your mask and remain socially distanced, 6 feet away from others. If you have difficulty walking to the entrance, both security and the National Guard will be on site with golf carts to drive you to the entrance. Now, in case of bad weather, there will be socially distanced queue in the indoor hallway, so no one will have to wait outside, especially if you follow the instruction to wait in your car 5 minutes until the appointment. Okay, now, James, if you'll show the vaccination site inside the arena now. Now, this is maybe a little bit too much information, but just stay with me here. You'll be entering the vaccination site. You see that in the green on the left side of the room. In case of bad weather, there will be a socially distanced line in the indoor hallway outside the entrance to the vaccination area. Now, once you get inside, there are going to be 4 stations, and these stations are check-in, processing, vaccination, and observation. Check-in, you'll need to show your ID, so please remember to bring that with you on your appointment day. Processing, at this station, you'll give your insurance information if you have insurance. And remember, there is no out-of-pocket cost to you to get this vaccination. Kroger is permitted to bill your insurance for an office visit, but you will not be required to pay for any portion of that bill not covered by insurance. Vaccination station is where you will actually get your vaccination. And observation, importantly, this is a waiting area where you'll need to remain for 15 minutes after the vaccine to be sure that you're okay and fine before leaving the building. Now, as Philly said earlier, the Kroger Horse Park vaccination site will be open from 10 a.m. to 4 p.m. Tuesday through Saturday during the first week. As Dr. Stack has said, the Find a Vaccine website and hotline will go live at 5 p.m. And once you go through the screening tool and find what you're eligible for in terms of the vaccine, you can click on the map location for the horse park, and find a link and a phone number to try to schedule your appointment. Now, in wrapping things up, I'll just reemphasize again what the governor and Dr. Stack have said. We appreciate your patience. This is the largest logistics effort and project in world history. Can't be put any more significant. And we've had 6 weeks to really stand it up. While the vaccine remains limited, we ask for your patience. Our plan, as the supply increases, is to announce additional regional sites in the coming weeks. The governor just spoke to that, while also continuing to work with local health departments and other providers. So watch these news conferences and the kycovid19.ky.gov website as we update the map with the new sites going forward. Governor.
Thank you to Secretary Gray, who has been a great addition to this team. Remember, 70 and up, 70 and up, all across Kentucky right now. If you're still in 1A, the other parts of 1B, we've either gotten through the first round of vaccines or they're already scheduled out there. So what we want in these next couple weeks is to try to have all these appointments to be Kentuckians that are over 70. This, again, will give a lot more protection to those who are most likely to suffer the worst of outcomes. Next, we're going to go to an update on UI from Amy Covich.
Hi, everybody, and a little hard to follow all of that good news about the vaccine with a UI update, but I'll have some hopefully good information for you on unemployment insurance as well. First, to our numbers of the 1.5 million or so claims from a little over 600,000 people filed through the end of last November. We still have about 86,000 with stops preventing payment on those claims. And of those, we can confirm the identities of about 38,000. And those would be the ones that have no fraud or ID issues. So those are the ones we believe are the actual live claimants who are still waiting for a claim to be adjudicated. Now, for a little bit of good news, there is a new program available that was put into place under the Continuing Assistance Act that was signed into law at the end of last year. It's called the Mixed Earners Unemployment Compensation Program. If you have regular W-2 wages, but also work some on the side and on a contract basis, then you may be eligible for this program. You must have received at least $5,000 of self-employment income in the most recent taxable year prior to applying for unemployment. For most people, if you applied in 2020, that means it'll be based on 2019. You have to be receiving a UI benefit other than PUA. This is only for people who are getting W-2 wages. It's not for people who are customarily self-employed. And you're going to have to submit documentation to substantiate that income. There is an FAQ that's going on the Kentucky Career Center website that will explain the kinds of documentation that you can submit. Tax documents obviously are going to be the best. If those are not available, there are some alternatives such as paycheck stubs, bank statements, contracts, other things. Now, what this will get you is an extra $100 a week for weeks ending January 2nd through week ending March 13th. This was an optional program that states were allowed to opt into, and even though it's probably not going to hit a lot of you out there, we wanted to make sure that we opted into the program so that Kentuckians can get every last dollar that we can from the federal stimulus programs. If you think this might apply to you, if you log into your UI account, there's a section under My Account where you can click File for MEUC and you can apply there. Still getting a lot of questions about 1099s. We know a little over 600,000 of those were mailed out over the last few weeks. And there is also a new FAQ on the website to help you with questions about that. If you look under important UI messages, there is a document there that you can click on to answer hopefully some of those questions. A lot of common themes we are seeing are what I talked partly about on Monday of where you haven't taken into account that taxes were withheld, or you may be comparing it to the payment screen on your UI account if you log in. That actually does not show all of the money that you were awarded, the $600 extra a week or the $400 extra under LWA later in the summer. Those are not in that screen, but all of that will show on your 1099. Now, if you believe that you got a 1099 and that you did not actually draw benefits, either because your business, the place where you worked, filed a mass claim and you never actually claimed benefits, or because of some kind of identity theft or fraud, you can email the email we discussed on Monday, the KYOU1099@ky.gov email. Provide your name as it would appear on the 1099, the last four of your social, an email that you can be reached at, a valid phone number to be reached at, and what you think happened, and a staffer will contact you back and try to work through that with you. We're still getting questions, obviously, about how the process of claims filing works, especially with the extension for PUA. We have a new infographic called What You Need to, that will be under the What You Need to Know section on the KCC website. this is what it looks like. I know it's a lot of information to look at on the screen here, but log into the website. You should be able to click on that. And this is a wonderful flow chart to explain to you how to make sure that you're applying appropriately for the benefits. On Monday, we discussed PUA back pay, and I said I would explain a little bit more about how that's going to work. What we're doing now, as those claims are being set up, you can always request the last 2 weeks on the system without having to submit cards for back pay. But our system programmers are running programming every 48 hours to find everyone who has been set up in the past 2 days and automatically push back pay cards out to you to fill out for anything that is older than those 2 weeks. So those should be happening automatically for you. Obviously, if something gets hung up, you're free to sign up for one of the virtual appointments, but that process should be happening automatically. And then one last reminder on the Bank of America debit cards. If you are one of those claimants, remember this is the last week that those received money, and you've got to spend off the money on those no later than February 28th. And that's it.
All right. Thank you to Amy. I know a lot of information today, but it's exciting. We are, already on vaccinations, vaccinating more people than we get vaccine. We won't be able to do that for long because we'll run out of the excess supply. But right now is when we build the infrastructure to be able to do more and more and more and faster and faster and faster for that moment that we get that additional supply, especially with some of the most recent announcements from the federal government. This is us doing our homework ahead of time and also providing more certainty for you. Now, the Kroger site I talked about is only doing a week at a time. That's going to change in about a couple of weeks. And as the federal government continues to be able to guarantee us minimum amounts for longer periods of time, we're going to work with all of the centers out there, the vaccination sites, to try to be able to schedule weeks out in advance. Because I know for most of you, even if you would be scheduled 3 weeks out, you'd love to get on the books knowing there's a time for you and will be a vaccine for you. So we hear you. All right, let's turn to questions. We'll start with Joe Ragusa from Spectrum.
Hi, Governor. So I have a few questions all related to the regional vaccination site, fairly simple and basic ones. So first, why prioritize, the group of 1B over 70 and older over even people that are also in 1B? Also, why this specific site in Lexington as opposed to either other sites in Lexington or other sites in Kentucky? And where might we see other locations that you're going to announce next week?
Well, we're going to announce them next week. This is just the first site. It's one that we could stand up that is on state property. It has a number of good advantages, being right off the interstate, having the internal roads, having the very large facility to do our tests, to work out all the kinks. This is a really good location for us to be working on. But you're going to see us around the state in population centers and in rural Kentucky to ensure that we ultimately fill out everywhere it needs to be. Why we keep saying 70 and up, 70 and up, 70 and up, these facilities will take other people in 1A and 1B, but all of the educators in 1B are scheduled out through their superintendent and a provider. Just about all of our first responders have already gotten through the vaccination process. So this is the largest group that is in 1B. It's trying to prioritize and create a number of appointments for them. But we believe that we've been working through everybody that falls within it. And we think we need at least a couple weeks, given that 1B is, altogether probably 500,000 people. And we were already through, the first 20+% of that before moving to 1C, which is over 1 million people. But again, to meet that 90% goal in 7 days of all the vaccine you get, you should expect to see Different groups dip into 1C when they have to meet that goal. Mike Valenti from WLAX.
Yeah, thank you, Governor. Good evening. Going back to January 14th, when you first announced this partnership with Kroger, and you said that essential workers in 1C would be eligible starting the week of February 1st. In retrospect, was that more of an aspirational goal? And given the supply constraints, was there something that you learned in the last couple of weeks that just didn't make that possible at the beginning of February?
Yeah, we wanted to be fully open to 1C by this week. There are two things that have kept that from happening. One is supply, and two is demand. We are seeing demand go through the roof in every single age group, even from 3 weeks ago, when we would see a certain percentage of pick any demographic that was worried about taking it. The very largest portion of every demographic now wants it, and wants it as quickly as possible. That is a good thing overall to getting to immunity, but it's a challenge as we get there. The other is supply. We had always hoped that we would see more and more supply, and we're getting that extra 16 to 17%, which we greatly appreciate. But given that so much of each of 1A and 1B now wants to get the vaccination, and we're vaccinating so quickly, we just need a little bit more time. But we're going to get to everybody. And remember, if you're in 1C, I know you want it, but we all understand those 70 and up face a lot of risk. So let's be safe these next couple of weeks. Let's wear our mask. Know that you're in that next group. And there are a lot of people that aren't in 1C. They're in 2 and 3 and 4. So you are a priority, and I believe we're all essential. We'll get there. We'll get there. We're not only going as fast as we can, we're going faster than we can based on our vaccinations in the last couple of weeks. Kristen Shanahan from WDRB.
Good evening, Governor. So I have a couple questions. One, can anyone in the state get vaccinated at these regional sites? For example, can someone from Louisville get their vaccine in Lexington? And then also, do you have a total amount of regional vaccination sites?
The answer is yes, you can sign up at these sites. We would prefer that you do it within your own region. The website will direct you to the one in your region. That is our strong preference, but at least in the Kroger site, it's not going to kick you out from being in another place. Now, some of our other partners that are out there, they're a little bit different in the way that their phone systems work and in the way that they are doing their signups. We'll get you the total number that's on the map. It's 34 as of today. Now that was quick. See, we got it to you. It's 34 as of today, building out. And again, some of your regional sites, their rules may be stricter in where folks are and where they come from, but please try to follow the one in your region. We are working every day to try to get these allocated by population. So they're most likely, if you try to sign up at 4 different places, all you'll get is frustration. Also, please don't be on more than one waiting list of some of these facilities that are keeping them. Otherwise, it creates a lot of work for the folks that are there when they have extra and they start calling. We want to make sure that next person that they call is there and ready to go. Shelby Smithson from WKYT.
Hi, Governor. Are there any specific plans or maybe public transit services being recruited in making sure that Kentuckians who don't have access to a car or aren't able to drive to these regional sites, that they do still have the opportunity to get vaccinated?
Yes. This is when we talk about thinking big and thinking small. There's this regional program that can get a lot of people through. And I hope that family members will reach out and solve some of those transportation issues. But then there's our local health departments, some of our hospitals that are embedded in each community, understand where folks are that struggle with transportation needs, understand the equity needs in getting this vaccine out. They're going to play an absolutely essential role in getting that done. So just because you see the regional sites doesn't mean that there aren't others. There are that are going to be getting vaccine and are going to be getting to those folks as we move forward. Again, our only limitation on our ability of how much big and how much small we can do is quantity we receive. Sarah Ladd from the Courier-Journal.
Yes, thank you. Can you clarify for me? So I know you said the Lexington Kroger site obviously was talked about a lot, and then you mentioned 2 sites in Paducah, a 4th one. Can you clarify where the 4th one is? And then just so I'm understanding correctly, the only one going live next week is Kroger, right? The ones in Paducah and that 4th one are later? Thank you.
No, okay. You're good question. I'll be clear, or I'll work on it. So we have the 2 in Paducah, which is Lourdes and Baptist, that are both in Paducah. We have Ephraim McDowell in Danville, and then we have the Kroger site. They are all going live next week, and then we are going to announce additional regional facilities next Thursday and the Thursday after. Secretary Gray, anything else to add on that one? Okay. And remember, 5 o'clock today for Kroger, 5 o'clock today for Find My Vaccine. That will direct you, if it's in your region, to any of those new sites for next week with their sign-up capabilities. One thing that we're doing and having to do is rely on some of the infrastructure of both Kroger's and these hospitals in the signups. If we can make that more efficient as we move forward, we want to, but we have seen the limitations of state government infrastructure as far as IT, and we want to make sure that with the number of people who want to sign up, we give you as few issues as we can in trying to get that done. But remember, in the next couple of weeks, next month, it may be hard to schedule an appointment just because there are so many folks that are out there that want it and that qualify. Karen Czar from WUKY.
Good afternoon, Governor. Hello, Virginia. There have already been stories popping up across the country of people getting scammed, thinking they can either pay for a slot or they're going to specialized doctors and finding out later on that they didn't even get a vaccine. Have you had any reports here in Kentucky, and what are we doing to ensure that that doesn't happen? What's your best advice? Thank you so much.
Well, you can only get a vaccine through a provider that is registered with the state and that we send those vaccines to. Certainly, people shouldn't be reaching out to you via email if you haven't reached out to them. Know that if it seems too good to be true, it almost always is. Go to the website. This will tell you the trusted providers that have the real vaccine. Specialty doctors and their practices right now don't have the vaccine. So all this is going, again, from the federal government through the state government system down to those providers. So you can know and you can check and you can always call any of these numbers to ensure you are getting it. Stu Johnson from WEKU.
Yes, thank you, Governor. Good afternoon. Dr. Stack in his comments mentioned about the possibility of once vaccinated, you can still spread the disease. So after your initial shot and a booster, should that person anticipate wearing a mask, say, into the fall?
So right now, we don't have, right now, we believe that the vaccines protect you from getting sick and protect you from getting very sick with that 95% effectiveness. There isn't data at the moment on the transmissibility. And so we have to believe that you can transmit it until we have the data showing that you don't, because we would hate to assume something with zero data and ultimately be spreading this. I think certainly wearing a mask is likely into the summer, and we'll see where we are on vaccinations from them. Wearing a mask is what we're going to be doing until either we have definitive data that you can't spread it or we reach immunity, which we hope to do as we get these vaccines out and out and out. So remember, it's a small thing to do. When we do it, we see our cases come down, but you can certainly expect me to continue to re-up that mask mandate to protect people over the coming months. But yes, this is going to be part of our normal until we reach immunity. But what a great day it's going to be when we can take them off. Now, I don't know what flu seasons in the future are going to look like. We've been so effective at fighting the flu, but it's going to be a good day, and I think it's going to be in this year certainly where masks are no longer going to be required. John Boyle from WFPL.
Hi, Governor. Wanted to ask about these regional sites when they open up in whichever counties you guys have planned moving forward. I wanted to see what guidelines or what tiering systems are going to take precedence, whether it's going to be the states or whatever minor tweaks a locality might have.
So the regional sites will be the states. There will be right now 1A and 1B. That's why we're talking about 70 and up. And then when we open it to 1C, that will admittedly be a crush of people. That's one of the reasons that we're having to build the infrastructure that we have to give as many vaccines as we can, but also to handle 1 million requests when they all come in that first day. So they're going to be following the state's directives. And remember, there are 2, and they have to be balanced. Directive number 1, try to follow the tiering, 1A, 1B, 1C. That is our healthcare workers, long-term care. Then it is those 70 and up, our educators and first responders, and then essential workers, those over 16 with conditions that make them more likely to have a negative reaction. But then the second directive is you gotta use at least 90% of the vaccine that you're getting within the first 7 days of getting it. Now, I think we're going to be even better than that, but if that requires dipping down to make sure that not one single dose is wasted, then we've given the authority to do that. And to date, I don't think we have a report of a single dose being wasted. Melissa Patrick from Kentucky Health News.
Hi, sir. A quick question and then another one. How many slots are available in each of the other 3 locations? And then also, why do you think the nursing home numbers have been getting better? And do you think it's too soon for the vaccine to have had any effect in those nursing homes?
So we'll try to get you numbers broken down by the other 2 locations. So next week in total, there ought to be about 64,000 and change total appointments across the Commonwealth. That's the number of first doses we're getting next week, up about 8,800 from last week. And we're doing our best moving forward to allocate those out as much by population as possible. Some of those doses are already scheduled, certainly in many areas, scheduled for first responders and others. But that's our weekly overall allocation. I believe our numbers in long-term care are getting better because some are getting second doses as well. At this point, more of the staff on the second visit are signing up to get the shots in the first, and they were holding back doses for if that happened. So it is good to see us improving in that area. We have been able to pull some doses back from long-term care and move them into the state program with where we now see the trajectory going. Certainly, we believe that there is some immunity. I've seen different numbers out there that you get after the first shot within a week to 10 days. So, all of our long-term care residents that have had the vaccination, and it's been that long, certainly have better defenses against the virus than they did before it. But to get to that full level, it certainly takes the booster. But yes, I believe our long-term care residents are better protected today than they were before they got the first vaccination, and that's why we prioritize them. Tom Latek from Kentucky Today.
Good afternoon, Governor. A quick one is, are we making good use of those supposed extra doses that are in the vials? And secondly, you've mentioned about when to get all the vaccines used, that they'll dip into the 1Cs. How will 1Cs be told that they can sign up and go get it?
So there, right now, in many places across Kentucky, there are waiting lists that go into even 1C. Our goal is to build an infrastructure where 1B and 1C can both be signing up, and 1B is prioritized. We're working towards that. Again, we're having to build this logistics system as we move forward. Also, these are providers, especially in the hospitals, that know especially the more medically fragile individuals in 1C because they are in their community. They know a lot of the other essential workers, again, in that same community. This is one of the advantages of having those providers that normally take care of people. And we know there are many more out there that want to be a part of our program, and we are going to get into the program. All right, I got a question here about whether we're going to extend the Ernst & Young contract for unemployment help. I believe we will eventually extend that. There are some things I believe that the Labor Cabinet wanted to finish to set the stage and best prime E&Y for their return to help us continue to get through claims. There is a plan in place for additional people to take calls, and we are working through that right now, hoping to have an announcement here sometime soon. All right, last but not least, John Charlton from WHAS.
Oh, thank you, Governor. I guess saving the best for last, I hope.
That's right.
As you know, I'll be asking about unemployment. You guys talked about the 1099-Gs and the issues that you've been seeing. What should people do if they have an issue and they're waiting to get it cleared up? What should they do about filing their taxes? That's one question. And the scope of fraud in not only the country, but in Kentucky, what is Kentucky doing about trying to identify identity theft and, free up some of these claims?
Right. So let me start with the second one. The system is identifying those claims because there are identity problems in them. That's one good thing that the system does. It's good at flagging those. We are still in the process of getting the last final notice to especially those claims that have all those identity issues that suggest fraud and have never communicated at all to the office, uploaded any documents or anything else. Those claims are going to get denied. I hope it happens here in the next week or so. We believe there are a significant number of those claims. And what that'll do is it'll push, it'll first of all deny any fraud claims, and you won't see them like they're real claims in our numbers. If there are a couple of individuals in there where the claims are real, it will put them in a different process where they can hopefully get more attention and have their claims addressed. Let's go to Amy on the tax question. I would ask everybody, go to the website, look through the FAQ, read the documents, because most of the time, like on all tax documents, it's going to be a misunderstanding. Amy?
Yes, please read the FAQs, but I would say since, the filing deadline is April 15th, as soon as you get that 1099-G, please check it, see if you believe you do have an issue, and reach out via that email and provide the information that is needed, your name, the last four of your social, and good contact information so that the Office of Unemployment can get back to you quickly enough and get you a corrected 1099 in time to make that April 15th deadline. So please, just when you get it, don't let it sit. I know in the past I've been guilty of letting my forms sit until it's almost filing time and then realized that I needed a corrected document. Please check it as soon as you get it so that we can give you the attention you need so that you can make all of your filing deadlines.
Great. All right, I need to make one clarification with what we're already seeing. Can you put the two numbers up for the Find My Vaccine? All right, the second number here is for the hearing impaired. And right now, I think there's a whole lot of people that are calling it that aren't hearing impaired. Listen, that's my fault. I didn't distinguish that in the beginning, but that second number, the 855-326-4654 is for hearing impaired. please leave that number for those individuals. Everybody else, call 855-598-2246. Remember, there are roughly 4.2 million of us that still want to get this vaccine if and when it's their turn. So we're asking for almost the impossible, patience, but it's also what we have to have with the limited supply that we have. We're going to keep pushing for more supply. We're going to keep trying to make this easier and easier for you. But remember, the most likely difficulty you'll have is that there is just not enough vaccine. But we're building the infrastructure to where when we get that big push, we're going to be able to get it out fast, get it into your arm fast. We are all going to get vaccinated, everybody who wants to. We're going to get it done in the coming months. So stick with us. We'll continue to try to improve every single day. We're going to defeat this virus this year. It's going to take us some time, but until then, keep wearing this mask. Remember, Team Kentucky is everybody. Is everybody making good choices? Is everybody doing the vaccinations? Is everybody doing the testing? Is everybody doing enforcement of the best rules? Is every employer who's put the right rules in place to keep their people healthy? It's all of us. So let's not have another day of 60 plus deaths. Let's make sure that that with our cases going down, with the vaccine here, with us getting through all the first round of licensed long-term care centers, that we make sure we lose fewer and fewer and fewer Kentuckians until we never lose a Kentuckian to this virus again. All right, we'll be back on Monday. Again, it's going to be an exciting week next week too. Next Thursday, when we further expand our map and get these regional centers closer and closer and closer to each Kentuckian. I want to thank Dr. Stack. I want to thank Secretary Gray. I want to thank Kroger for being on today. I want to thank Amy and everybody else, and I want to thank all of you. We'll get through it. We'll get through it together. Have a good night.